Hey guys, Dr. Paul here. So I understand that you've got some pain from a wisdom tooth and you want it gone. Well, you're not alone. It's really common. In this video, I'm going to give you some tips that should give you some relief before you can get to visit a dentist. So the first thing that we need to do is work out what the problem is. And there's two possible causes. One is from the tooth itself, or two, it's from the gum. And the easiest way to do this is by looking at it. Now, you might want to use a mirror with the help of a torch from your phone, or you might need someone to help you, but there's two different things that we're looking for. The photo on the right here is a wisdom tooth with a really large hole in it. The one on the left is a wisdom tooth that, yes, it's a little bit dark on top, but the main thing that we're looking here is that the gum is swollen, it's red, it's inflamed, it's infected. There's two different situations here, and depending on which one you've got, there's different possible solutions to help you. So if yours is more like this one, you have a hole in your tooth, basically what's happening is the nerve endings inside the tooth have become exposed, and this is your body's way of saying, hey, there's a problem, we need to get it fixed. Now, before you can get to a dentist to get this checked out, the best thing you can probably do is to get some temporary filling material. Now, these can be picked up from your chemist or pharmacist. Basically what it is, it's like a putty material that you would put over the top of the tooth, and its job is to basically fill that hole. Now, it is only a temporary solution, and it's until you can get to the dentist to get it properly fixed, whether it be to have a filling done or to have the tooth just taken out altogether. You may also find it helpful to avoid hot, cold, and sweet things, as these can be triggers for toothaches and tooth pain. So if you have the gum problem, basically what's happening is this is the body's response to bacteria that live under the gum. The basic process is that food gets stuck underneath the gum there, and it's really hard to keep clean because the gum grows over the top of the tooth. When that happens, that food provides resources for the bacteria. Slowly over time, their numbers increase, and the body's response to their numbers increasing is to try and kill it. It does that by inflammation, infection, swelling, and you end up in a situation like this where it's a whole bunch of pain. Now, this can happen at times where your immune system is slightly down. It might be that you're stressed from work, or you might have exams, you might not be sleeping enough, you might be sick, or you can just get really unlucky and get it at any time of the year. So to fix the problem, we need to try and get rid of the food and the bacteria. However, this can be difficult because of how sore the gum is. So your first line might be just trying to get some relief. Now this can be done with a numbing gel. Basically it's an antiseptic gel that also contains a local anesthetic that you would rub onto the gum to give you some relief. You can purchase this from a chemist. The next thing is to take some medication. The two that I recommend are... Hey, super quick, if you're getting something out of the video, please like, share or subscribe. It really helps me out a lot. Alright, back to the video. Ibuprofen and Paracetamol, or acetaminophen overseas. Now, ibuprofen is an anti-inflammatory, so its job is to reduce the inflammation in this area. That'll give you some relief because it will decrease the swelling, and often the swelling actually is a big cause of the problem because when it's swollen, you end up biting down onto it with your top teeth, which just makes it a whole lot worse. So reducing that swelling and inflammation will be great. The other one is paracetamol, and this is just a straight up pain relief. Now, the other thing you can do is you can get them together. So this is acetaminophen, take them both, it makes it much easier, it's in one tablet. The maximum dose for these is 4,000 milligrams for paracetamol and 3,200 milligrams for the ibuprofen. This is for an adult. It is dependent on weight and age, so do look into that for yourself. And if you're pregnant, don't take the ibuprofen unless it's instructed by your doctor. Some people also find some pain relief from ice packs, especially if the pain is radiating up to the ear or to the neck region. You can leave them on for 20 minutes, then take them off for 20, and then you can rotate them. It will actually reduce some of the inflammation around the site, but it more so provides a soothing and a numbing effect. So like I mentioned, the main cause of the problem is the body's response to the food and the bacteria. So logically, we need to remove that food and the bacteria. We're going to do this by brushing the area really well. Once you've got some relief and you can use your toothbrush, that's the best thing for it. Now you can use a regular toothbrush, or you can use this guy here. This is what we call an end tuft brush. It's a little bit smaller headed and it's also on an angle. Now if you don't want to go out and get one of these, you can use your regular brush, but it is a bit harder to get back there. Or you can actually chop off half of the tips of the brush and use that because it makes it a bit smaller, a bit easier to get in. Now the goal is to get those fibers as far under the gum as possible to remove that food and to disturb the bacteria in the area. Definitely do this after your morning and nighttime brush, but ideally after eating as well, because that's when the food's actually getting in underneath the gum. So the last thing that you can do is a mouthwash. So the best one that you can get is this guy here. This actually has hydrogen peroxide in it. Now the bacteria that cause the problem, they're anaerobic bacteria, which means they don't like oxygen. Hydrogen peroxide is so good because it releases oxygen. So how you use it is by rinsing twice a day for about 30 seconds each. But the other way that you can do it is by actually putting some on your toothbrush or your end tuft brush and brushing in underneath the gum there to really make sure that peroxide gets in and kills all of the bacteria that are in the area. Now, if you can't get access to this, the other thing that you can try is a warm saltwater mouth rinse. It's not going to be as effective, but you might find some relief with it. So while these tips may help, I do find that in most cases, when patients have wisdom teeth pain and then it goes away, typically it does come back. So if you want like a long-term solution, going to see the dentist is probably the best way for that. But I hope you find some relief from what I've given you today. So to summarize, if you have pain from your wisdom tooth area, it's generally one of two things. The first thing, it's from the tooth. The second, it's from the gum. If it's from the tooth, it might be because of the hole that's there. If that's the case, the best thing is to see the dentist. But in the meantime, you might want to plug that hole with some temporary filling material that you can get from the chemist and avoid things like hot or cold foods that might make it more sore. So the second thing is from the gum. If that's the case, there's a few things you want to try to do to get some relief first. One that you might try is some topical numbing gel, so you just smear that on the area. You can also try some pain relief. So some medications that we recommend are Ibuprofen plus Paracetamol. They work really well together. One's a painkiller, one's an anti-inflammatory, which will reduce the inflammation and the swelling. You can also try ice packs. Ice packs are really good to be applied on the outside of your face. It gives a numbing and soothing effect, plus it will reduce some of the inflammation and swelling. Once you do have that relief, it's really important that you get in underneath the gum to clean it out with your toothbrush. That's to get rid of the food and to disturb the bacteria that are the main cause of the problem. The other thing that you can try is a mouthwash. The mouthwash that you want is a hydrogen peroxide containing mouthwash, because that'll actually help kill the bacteria that cause the problem. Anyway guys, thanks so much for watching. If you got something out of the video, please like, comment, subscribe. Those things really help me out a lot. If you've got any questions that are specific to you, please put it in the comment section. I always try and endeavor to get back to everyone within about 24 hours. Have a great day. Hope you get some relief from the video and keep on smiling.